Hello everyone, you're most welcome back to my YouTube channel. My name is Sydney, your reproductive healthcare expert. And today we are going to be discussing about something very interesting. Guess what it is? So we shall be looking at the top 10 reasons why your vaginal infections and low abdominal pains that results from vaginal infections just keep on coming back, even after you've gotten treatment. That's how interesting it is today. So stay tuned and let's jump right into it. So guys, it's me, you're most welcome back to my YouTube channel, and today we'll be looking at this interesting thing. Now, I would like to begin by telling us that not all low abdominal pains come because of the vaginal infections. But today I would like to emphasize and explain for us and get to know, let's get to dig deep and know why we keep on getting back these infections even after we have gotten treatment, even after we feel we have followed all the doctor's prescription and dose of medications. So that's what we are going to be looking at today, and straight away let's jump right into it. But first and foremost, I would like you to know that not all the low abdominal pains that you get are due to vaginal infections, but in most cases they are due to that, especially on the front part. So let's look at the reasons. Number one, you're probably not treating your partner. Okay, when we get vaginal infections, most of us ladies, I'm talking about you rush and get treated, go to your healthcare providers, they give you proper medications, you get treated, but we forget to treat our partners. Okay, you're not treating your spouse, you're treating yourselves. Well, the infections might clear, but the moment you go back and become sexually active, that infection is just gonna come back. So let's remember to treat our partners. Then two, you're not abstaining during treatment. Very interesting. Guys, very interesting. In most cases, my patients, I always tell them, please, when you're taking your medications, do not have intercourse with your partner. But we go ahead and do it anyway. You say, whatever. We go ahead and do it. But remember, when you keep on having intercourse while on treatment, what is going to happen? Well, on the opening of the genitals, we have microscopic wounds, okay? Microscopic wounds formed during intercourse, and these are openings for the pathogens, for the disease-causing organisms. That's what I mean by pathogens. And they keep on entering there and increases the chances of more infection multiplying in your body. Also note that the bacteria in your partner, in yourself, can use the protein that are coming from your partner's semen as nutrients, as food. Vaginal infection, I just want to give you an example that you can easily understand. I should know that I was bitten by an infected mosquito which has the malaria parasites. So the same thing, when you have these vaginal infections, know your infectious sources. What we think is that sometimes the infectious source is only our spouse. So you would say, well, I treated myself, I treated my partner, and then why am I still getting back these infections? Well, it's simple, okay? There is something else that is bringing it. Guess what it is? The latrines, the urinary shelters. Unfortunately, in most of the parts of the world, like here in Africa, for example, people go for short call, people go to the urinals, and then the same place they are going to take your bath, it's the same place someone is going for their short calls and showers. So it gets really a bit disturbing. Okay, so if you are showering or sharing public latrines, and you have to be careful, because this is how the infection takes place. Okay, you require just one drop, which might sometimes be really tiny, to flush of the infectious fluid from the floor of the bathroom, to flush back and touch on your vulva for you to get the infections. And if it happens today, it will take you the next 10 to 14 days to realize that you're now to start getting those symptoms, okay? So what are you supposed to do? Well, get a bottle of Jik, pour like 3 tiny leads in water, about quarter bucket, sprinkle it on the bathroom floor before you shower, then get clean water and shower. Then in the toilets, get these small bottles of sanitizers, okay? Empty the sanitizer off, put Jik there, spray these ones that come in form of a mist at the opening of the latrine, then you can, or the toilet, whatever, and then you can use it safely when the infectious bacteria or pathogens or fungus, virus, whatever the case may be, has already gotten destroyed, okay? So that is very important. Let's kick right into number 5. You're not completing the full course medication prescribed for you by your healthcare provider, okay? So we take medications for 5 days and the symptoms disappear, the itching stops, the burning stops, the irritation stops, the painful intercourse stops. Then we are so excited. But my dear, remember that after you've started taking medications, the concentration, the number, the population of these pathogens starts to reduce. I say pathogens, I mean the disease-causing organisms. They reduce, and when they reach below a given value or number, the symptoms will disappear because their number is not sufficient to keep on causing you what? Those signs and symptoms you feel. However, these pathogens have not yet completely disappeared. They are still there, just that their number is too small to cause you any issue. So for that reason, let's not relax. Let's finish the full course medication. And at this time, you'll not feel any symptoms. But when you stop your medications, they will still multiply and come back, okay? So let's remember that number 6 is very interesting. That's hygiene. I know people tell me, oh my God, Sydney, I shower every day. I shower morning and evening. And I don't know, what's yes, even if you bathe 10 times. The thing is that most of us do not know how to wash our female parts. We do not know how to wash the what? The vaginal cavity. Okay? So if I would summarize it, I have to make a full video on about how you can clean your female parts. Okay, because we do not know, it's the fact. I don't know why some people end up laughing when they hear this, but it's good. It's good to talk about the truth, okay? So when you're cleaning, I'll try to summarize it because it's a whole lot of things. I need a full video to cover how to clean the vagina. One thing I can tell you is the external genitalia, the vulva, what you see there, it's okay to clean it with soap. But the vaginal canal, the vaginal introitus, inside that opening, soap must not enter. Let's get that difference very, very clearly, okay? Soap shouldn't enter in the vaginal introitus, but you can clean outside. It's something that happens sort of like, let me say, the eyes. When soap enters the eyes, what happens? It irritates. It's the same thing with the what? Vaginal cavity. It's designed to clean itself. But sometimes we allow soap to enter there. We touch some people on IUD, okay? IUD, intrauterine cervical device, the family planning. Some people might not know it. And they insert their finger inside the vaginal cavity to check it out. That's really wrong, okay? Because you're introducing infections there. Then also about hygiene, I think I'll talk more about it towards the end of the video, also in something related to sanitaries. So about hygiene, that is what I am meaning. That's the most important thing. 1 handy per day and all that. So let's remember to also work on that, okay? And then next, I would like to go ahead and talk about using the wrong medications. Sometimes, you know, whenever I feel burning urine, I buy antibiotic A. Then the next time you feel a burning urine, you go to buy antibiotic A. Huh? But you do not know that this antibiotic A that you have gone to buy might not be the best medication for this particular infection that has gotten you. Some infections are different and they present in the same way. So consider asking your healthcare provider before you just what? Go ahead and take that wrong medication. And some of the wrong medications, you may have infection Z that needs antibiotic A. Then for you, instead of buying antibiotic A, you buy antibiotic C. Antibiotic C will have some small effect on that infection Z, but not treat it completely. And then you come back, my infection is not going away. I've taken medications. Are you serious? Which drives us to the next. And that is to say, wearing nylon or rubbery synthetic underwears full time. When you do that, what happens is aeration down there becomes insufficient, so the environment becomes a little bit anaerobic, and you're going to create the favorable environment for especially fungus, like those that cause, for example, vaginal candidiasis. You're going to, because of what? Poor aeration, okay? So remember, guys, remember, ladies, when I say guys, people think I'm talking about men only, but let's say ladies and gentlemen, because gentlemen, you have to support your partners. Remember to give advice on the kind, and buy your girlfriends cotton underwears, okay? Advise them to do so. You know, sometimes I'm a lady, you get from me a nylon. I want a nylon underwear for a birthday gift. I'm not gonna deny it, I'm gonna use it, okay? So guys, men, let's also try to support our partners very well, so that we put on the right thing. Always buy cotton-based underwear. It's comfortable, it's good, and it's okay. And also, let's remember to avoid, sometimes we put a lot of chemicals down there, want to smell good and all that, but if they take long, some becomes actually pathogenic, some becomes disease-causing sources. So the next one is very interesting, and that is delay to pass urine after intercourse. After intercourse, there is always that urge to pass urine in both sexes. So some of us ignore it, just sleep, some don't. By the way, that thing you feel is to clean the urinary pathway. So if you've had intercourse, there is a lot of semen clogging in there and you don't pass urine, it's gonna become infectious because bacteria will begin to sprout and grow there. Still the same thing, the urge to pass urine, if you do not pass that urine out, it becomes toxic to your body and can end up causing you conditions like something we call bacterial vaginosis. I'll make videos on the different types of infections, but that is it. And then another thing that I would like to still talk about within the scope of, let me say, this delay to pass urine is, even if you have not had intercourse and you feel like passing urine, especially for ladies, please do not hold the urine. Go and pass this urine so that you get what? Relieved. And then the next thing I would like to talk about is poor use of reusable sanitary pads. I am not saying that you shouldn't use reusable pads, but I am saying you should, if you have chosen the reusable, you know they are not that easy to use because for you may not understand, then you should be ready to take the task to use it. For example, someone uses a reusable pad, washes it, and dries it. My dear, you're going to bring back infections if you've ever suffered from it. These reusable pads, after using, you first of all need to soak it in water that is containing some jik, sodium hypochlorite, okay? Now after soaking it, I apologize for that. After soaking it in the jik, what you're going to do is that you remove it after about 10 minutes, wash it with proper detergent, rinse it in very clean water, hang it to dry in the sun. After drying in the sun, then you iron. And it should be exposed to the sun when it is dry for a minimum of 2 hours. Meaning, after it is fully dry, that's when you start timing. At least 2 hours, then after that, you iron it. Because blood is one of the most infectious sources. It has been soaked in that sponge. What do you expect? There are disease-causing organisms that are hiding there. I would not like to go into so much depth medically explaining this. I just want to hit on the surface such that we are all able to understand it fully and not start saying, doctor, what you did is you explained some medical things we were not understanding and all that. You know, I am very happy with you for watching this to the end of the video. For that reason, I'm going to give you a bonus. And the bonus is that we fail to have treatment discipline from our doctors. The doctor said, you're taking this antibiotic. Make sure you do not take milk when you're taking these medications. Because, yeah, there is a medication when you're taking, you're not supposed to take milk. But some of us say, when I take milk, what happens? Will I die or what will happen to me? No, you won't die and all that, but you end up what? Taking milk. So thank you so much for watching this. And remember to like, to subscribe, to share, and comment. When you do give me comments, it gives you also comment on the next topic you want covered. And I'll get you sorted in just a jiffy. If there is any issue you would like to tell me, here is my email. Remember to email me here and I help you immediately. So thank you very much, viewers. Bye-bye. Nice time.